All right, so chapter 14 is filled with a ton of information that you guys are going to have to know. These are things, a lot of the skin stuff in here you've learned already previously, but the book does a really nice job of outlining and teaching you which each one of these skin problems are. We're going to go over them in a little bit of detail here, and then we're going to talk about wounds. We're going to talk about pressure ulcers and Braden scale and all of that stuff. So yes, this is outlined for you. I'm trying to do a little bit of both here so everybody gets to learn the way they learn. So we will still do Jeopardy in class, but you'll have access to these obviously now, and then you need to do your reading, and you really do need to do this reading. So anyway, so let's get started here. I'm not going to read these slides, so you can, these will be uploaded for you. You'll be able to read this stuff. This is just outlining the book. I'm going to go more specifically on content here, which is going to include all of these. So in the next couple of slides, not everything is outlined, but you do have to know all of these. And again, this outlines it for you. Specific ones that are not discussed in detail on the slides include scabies. That's on page 186. These are little mites that cause major itching, especially at night. They burrow into the person's skin. It is contagious. So when we have patients in the hospital that have scabies, they have to be put in isolation. Nothing gets a nurse itching quicker than finding out their patient either has scabies or lice. Purpura is a thinning of the dermis that leads to increased fragility of the dermal capillaries, and they're easily ruptured of the blood vessels. So you're going to see underneath the person's skin, it's going to look like maybe little veins or little like reddish purple color areas. So that's what that is when you see that on typically older adults, but younger people could get that too. But it's caused from the thinning of the skin and easily ruptured blood vessels underneath. Skin tears, we all know what skin tears are by now, hopefully. You'll see that on page 187, there are categories of skin tears using the Payne-Martin classification system. Category 1 is a skin tear without tissue loss. Category 2 is a skin tear with partial tissue loss, and Category 3 is a skin tear with complete tissue loss where the epidural flap is absent, and then talks about management of skin tears and things of that nature. And then the next one that's not outlined for us is candidiasis. This you can find on page 189. This is a fungus. It's referred to as yeast. It is present on any person at any age, but your book goes on to talk about how our patients, our older adults especially, they have diabetes or steroid therapy, that yeast can grow, especially in areas like the skin folds in the axilla and the groin area, under pendulous breast. We also know patients in their abdominal folds. So this is where we're going to be checking their skin for that, and then we'll be treating it usually with powders or creams. Make sure that you read through all of that, though, on that page, and actually all of these. Make sure everything is read through, and any questions at all, please post them in the discussion board or bring your questions to class. So the first one that is outlined for us is xerosis. Sorry, I know this is a little bit broken up at times. As soon as I started talking, my animals started going crazy, so I have to keep stopping. Okay, so xerosis is extremely dry, cracked, and itchy skin. Xerosis is the most common skin problem experienced, and it may be linked to a dramatic age-associated decrease in the amount of epidermal filaggrin, a protein required for binding keratin filaments into macrofibrils. So that's just giving you the big words for the skin and how there's that decrease that's happening in the buildup of the skin. So this is going to be very itchy, or pruritus is it's gonna make it itchy, but it's gonna be itchy. It's really dry. It's cracked. We especially see this in the extremities, like the legs, and the skin of the older adult, because it's thinning. It allows more moisture to escape. So that's xerosis for you. Pruritus, this is itchy skin, so that follows right after xerosis, and it says right in your book, one of the consequences of xerosis is pruritus. That is itchy skin. So you can read through that and see everything that the book has to say about pruritus. Carrots, remember we already did scabies and purpura, and skin tears, so those aren't specifically outlined, but you do need to read through those and know those. Keratosis, you'll notice that there are two types of keratosis, the seborrheic and actinic. Okay. The seborrheic is on page, I just turned my page, 187. And this one is a benign growth that appears mainly on the trunk, the face, or the neck. The scalp is a single or multiple lesion. They're common more so in people 65 years and older, more common in men. It looks like a waxy raised lesion, flesh-colored or pigmented in various sizes. It has a stuck-on appearance. It may be removed for cosmetic reasons, and here's what it looks like. And then you have the actinic keratosis. This is a precancerous lesion that is thought to be in the middle of the spectrum between photoaging changes and squamous cell carcinoma, which we're going to talk about in a little bit. You can read through that part to see the different things, what they say causes, and that early recognition treatment removal. Here's a picture from the book that shows you know how I am with words, but anyway, that's what it looks like. Your next one is herpes zoster. This is shingles, most common in people over 50 years old, and those who have medical conditions that are compromised, that have compromised the immune system. So sometimes we'll see younger people with that. Herpes zoster is caused by reactivation of latent varicella zoster virus. That's the chickenpox. So it's important to know that stuff, guys, because people that have had chickenpox can still end up having shingles later on. That happens actually quite a bit in our older adults, but I've known young people too. It talks in the book about the vaccination. It talks about Healthy People 2020. These are all important things that you're going to want to make sure you read through and outline and understand with this chapter. Candidiasis is the next one that's outlined in there, but it's not on your PowerPoint here. And I already talked about it a little bit, but do be sure that you read through that. And then photo damage to the skin. We know that we need sunlight for the production of vitamin D, but the sun is also the most common cause of skin cancer, or skin damage and skin cancer. More than 90% of the visible changes commonly attributed to skin aging are caused by the sun. So we know that as a nurse, we're wanting to teach our patients to limit their sun exposure and use sunscreens regularly regardless of skin tones. But we do have certain skin tones that are more susceptible to some of the cancers and that, which we're going to talk about in just a minute here, or actually right now. So there's just some facts and stuff on skin cancers. You can read the facts and figures on page 190. And then our first one is basal cell carcinoma. This is the most common skin cancer. It occurs in older adults, but your book talks about how it's occurring more and more in younger people. It's more prevalent in light-skinned people. You're going to see this more commonly, as I was saying, triggered by extensive sun exposure, chronic irritation, chronic ulceration of the skin. And then you can see the treatments that are used for that in the book. There's a picture of it. And then you have your squamous cell carcinoma. It's the second most common skin cancer. However, it is aggressive and it has a high incidence of metastasis if not identified and treated promptly. And I've actually seen this in one person that I took care of at one time, and it had got to the point where we couldn't even treat them anymore. So it's important for us to be teaching skin assessments. This is found on the head, neck, and hands. Lesions are firm, irregular, fleshy, pink-colored nodules. It may look like a wart. And so anyway, that's the second most common skin cancer, squamous cell. All right, melanoma. This one is less than 2% of cancers, but it accounts for the most skin cancer deaths because it metastasizes very quickly. it is a highly curable if the cancer is detected in the earliest stages and treated right away. Make sure you read through the incidence and prevalence of melanoma and the risk factors of all of these cancers. That way you have the idea of what causes and what nurses can do to teach their patients. And then recognition or prevention and early recognition. Again, this kind of goes through the stuff that we need to do as nurses. You can find a lot of this under the on 191 implications of geri nursing and healthy aging. So there's some more stuff that's actually right from page 192 for you. And that is also the ABCDE. You're going to want to know that. Make sure that you go through that and learn that, know that we're going to be teaching and using that scale, especially if we're working with older patients and those that have skin cancer or even just, other kind of skin issues that are going on. So, scabies is actually here. Well, we already talked about scabies and purpura. We talked about skin tears already. Preventing skin tears, we know that we need to use paper tape on our patients that have that thin skin. We want to try not to put those super adherent dressings on them. It's important that we want to make sure that we're very careful when we're moving our older patients with thin skin, and, pulling them around the bed, moving them to wheelchairs, all of that stuff that happens. We did candidiasis, preventing fungal infections, oral thrush, that's, the fungal of the mouth. It's associated with poor oral hygiene and immunosuppression. There's medications as well that can cause that on people. And then now we're going to do pressure ulcers. All right, this starts on page 192. And if you look over in box 14.4, I imagine it's probably on here, it goes through the stages. And so the stages are going to be really important for you guys to remember and recall and learn if you do not know them, because we have to know as nurses how to stage pressure ulcers. Remember that if pressure ulcers are acquired in the hospital, that they're not going to be paid for. Older adults account for 70% of the pressure ulcers. We understand why these develop. We have so many things in place to try to prevent them. And so it's important for you guys to know all those different things, things like our Q2 turns and padding those areas that we know will have the pressure on them. Our patients that have that are incontinent. And then if you look at box 14.5 on page 195, it talks about pressure injury risk factors. And so you want to go through all of those. That's listed there for you as well. So again, please make sure you outline that area well and know it well. Come to class with questions on it. If you have questions, or better yet, throw them in the discussion board so we can discuss them there first and then reinforce them in class. So all right, that's it for that. And there's some more prevention stuff for you guys. And then implications of geriatric nursing on page 196 talks about our skin assessments. Now we know we use the Braden scale for that. And it's important to know your Braden scale and how to use it. Most places, I know McLaren does, we actually document in the Braden scale every single time we assess a patient. These are all the things the nurse is going to do that we need to do to try to help our patients with skin issues, our risk assessment, and then the Braden scale. Make sure you go through that. This is assessing the risk of pressure ulcers on the basis of a numerical scoring. The 6 factors are sensory perception, moisture, activity, mobility, nutrition, and friction and shear. So again, we want to make sure that we have a good understanding of the Braden scale. And then the mnemonic for pressure injury treatment, DIPAMOPI. This I actually will not require you guys to know, okay? Go over it, it's important to know, but you don't have to know this in depth or anything. And then our injury care, you can read through this in the book, and that's it for chapter, 14. So the other chapters will be coming as well, but this can get you started.